we know that there's so much stuff going on in the city, right? And so I wanted to bring in an organization that does health research, and they carry out research, really research I don't want to do because, promising new cures and treatments for different types of diseases. Now, especially today, we're going to be talking about heart and kidney health in Milwaukee, right? So we've got this great thing, Care Access, and I have a guest. And, usually I introduce my guests and talk about their background, but I'm going to let her do it herself.
Awesome. Thank you so much, Dr. Harris. My name's Joanna Dorbin. I'm with Care Access. And yeah, I'm very excited to be here to share what we're doing in the Milwaukee area. Not just in the Milwaukee area, though. We are doing community outreach events all over the U.S.
Mm-hmm.
And what we are doing here this weekend, today is the 2nd through the 4th, so Thursday through Saturday,
Mm-hmm.
we are doing a free blood screening, looking at kind of your heart health, your endocrine health, as well as your kidney health, all in one free screening for patients.
Now, when you say endocrine, what is that?
Thank you for catching that. Yeah, so that is like your blood sugar levels
Mm-hmm.
and how well your body is processing the sugars that you intake.
So you can check to see whether or not somebody is pre-diabetic or diabetic, and which then affects your kidneys and on and on and on.
There's a lot of interplay between those three measurements that we're looking at.
And so it sounds like one of the things your company does, and by the way, I have to say you were instrumental in being at our Alpha Phi Alpha Midwestern Regional Convention, and that's why I met you.
Yeah.
And you were so energetic about it. But the thing that threw me about it was the fact that you look at the heart, but you also look at the blood to make sure, because those are the two things in your body that if one of them goes wrong, it pretty much shuts down everything.
Yeah.
So this is a heart and kidney screening, but you're only going to take blood?
Exactly.
How is that?
2 small vials of blood. And actually,
2?
Just small vials.
Okay. All right.
And that's a good point you make there. What we are actually calling this program is the Future of Medicine Cardiometabolic Health. And so those two
You science people be coming
together.
up with some.
So cardio, meaning like the heart.
Right.
Metabolic, meaning your, again, like diabetes markers and how well your body is processing sugars, as well as the kidney health and function. And so that's kind of what this blood draw screening is looking at.
And so when I look at it, we've got scientific studies, and we all know that in the Black community, the chance of sort of suffering a heart attack or kidney disease is significantly higher. But we're also finding that food may not necessarily be the reason. It may be genetic, based on what region you were born in, or it's such a myriad of things. How do you figure that out?
Well, first, that wasn't me, so I'm not a physician or a scientist, and I can only speak from
from the
high
numbers and the
level,
data,
and those
Absolutely.
things, and I can't speak too much to the I won't be able to speak too much to the mechanism. However, I will say there's a few pieces to answer that question. On the face of it, that may seem like a simple question, but I think breaking it down, starting off, I think I will say at Care Access, we believe, for example, why is one population affected more so than others? That this disproportionately stems in large part from the fact that, for example, Black communities are historically underrepresented in medical research. And that's actually kind of what we're trying to change at Care Access, right? We're bringing these screenings and access to being able to participate in research directly to the Black and other underrepresented groups to make it easier for them to participate in clinical research.
Now, when you say underrepresented, that's underrepresented in the medical research that's been done that tends to only include predominantly white populations, but then the treatment only affects predominantly white populations.
Exactly. Well, to what you're saying, when research is only done on one people group, based on your genetic background,
you can't extrapolate to other groups.
You need concrete evidence to show how this medication is going to affect someone based on their genetic background. actually, in anticipation of this conversation, I did a little bit of digging on my own. So interestingly enough, right, to the question of with the Black population, why does there seem to be more of a prevalence of chronic kidney disease specifically? There's a paper, not mine, by Dr. David Freeman and Dr. Martin Polak titled APOL1, nephropathy. So nepher is originally, it's a Greek root,
right,
meaning kidneys. Pathy is suffering or disease. And from genetics to clinical applications, I think when it comes to all these like little mechanisms and biomarkers, I don't know about you, but when you're getting your blood test at your doctor,
right?
When have you heard of what cholesterol is meant to do? Like what the benefits of cholesterol are? I don't know if, at least from my perspective, all I hear is like the bad things that cholesterol does in your body. But the reality is, whether it was by design or evolution, the things that make us up in our bodies are meant to be in balance, right? And there's a reason for them. Like cholesterol is a building block in how your cells are made, and also to insulate those cells. Interestingly, so the APOL1 genetic variant, there was a benefit to a specific subset of these variants in sub-Saharan Africa thousands of years ago. And 2 variants rose in prevalence because they gave enhanced protection against African sleeping sickness.
Right.
So, unfortunately, in modern times, right, it's not protective anymore. And scientists seem to be finding that, this may be one of the leading causes to a higher prevalence of chronic kidney disease in certain populations. And that, I think, is one of the really important reasons for research to not, like, diversity is one of those words that I think people throw around. I heard you talking earlier a little bit about that, right?
Yeah.
And I think it's more just an accurate picture, right, of the people in the world that are going to be affected in medicine by the medicines that that companies are producing. So.
And it really includes everybody.
Exactly.
It includes whites, blacks, people of sub-Saharan African descent. It's everybody. And so I think one of the great things you guys are doing is you're going to set up this screening and you're going to go in, and if people want to be a part of the actual, process and the project, you can actually sign up.
Exactly.
And so what would I have to do?
An easy way to kind of get some more information, not just on the screening we have in Milwaukee here today, but any other ones, go to myfreehearttest.com. That'll have a list of all of our events and the addresses and the places where you can go get that screened.
I'm actually in 2 studies.
Oh.
And they're longitudinal studies. I've been in one for over 10 years.
Wow.
And they started a new one. And so I became part of the new one. So it's been an interesting trek. So when I talked to you at the convention and I heard it immediately touched a few things because I have acute glomerulonephritis. So inflammation of the kidneys, right?
Yep.
But my doctor taught me as a kid, hey, when you drink this, drink that. I was like, what? He said, yeah. So for every this many ounces you drink of coffee, drink this many ounces of water. And if you match it, you'll be fine. And he told me my kidney percentage of, all that. And so I thought it was great. But then if we're historically, and before we go to break, I really want to ask if Black communities are historically underrepresented in medical research, this is a way for you to increase and do research that will directly affect the community.
Exactly.
How will it come out in the end? Will it come out in the end of scientists using it to create medication or treatment? How exactly does that work?
That's one aspect of it for sure. And I think the other aspect of it, one of the things that we're testing for is Lp(a), which with your cholesterol test, you have your HDLs, which are the good cholesterol, and then the LDLs, which are the bad. And in a typical blood test, they don't tell you what percentage of your LDLs are Lp(a). And Lp(a), like I mentioned, is genetically driven. And so I think they're estimating that roughly 20% of the population at large probably is living with elevated Lpa, and they just don't know. Because as of right now, insurance doesn't cover that specific blood screening. It often comes out of pocket. And it's
so you're going to do it?
So we're doing it for free.
Wow.
Yeah. And so part of what that data is going to is better.
Saturday.
Yeah, we're here Friday, Saturday. That research and that data is going to be painting a broader picture because we know there are specific people groups that have elevated Lpa in compared to others, right? Our tendencies. So that would be both the Black community as well as like Southeast Asian tend to have elevated Lpa just based on genetics. And the tricky thing is diet and exercise doesn't lower the LDL that's Lpa driven. So yeah, being able to participate in research, I think, is key.
I hope to learn more. So Joanna's going to hang out a little longer, right?
I'll be here.
All right. You're listening to Truth in the Afternoon. We are talking to Care Access. I'm going to mess up your last name, so I'm going to just say Joanna.
Yeah, it's Dorbin.
Dorbin. I'll never get that right.
That's okay.
Joanna Dorbin from Care Access. When we come back, we want to talk about some of the things that are the causes of that. I want to look at some of the sub-Saharan African and just how all that happened and go into all that and more. In studio, we have Joanna
Dorbin,
who is from Care Access. I looked at that name and I saw it. I said, I'm going to mess that up.
I married into it. So.
I got it written down. It's not good. So I wanted to dive into some stuff, and you may or may not be able to talk about it. But first thing I want to say is that if you're interested, go to myfreehearttest.com. They'll have screenings here in Milwaukee. I guess you can sign up for the one tomorrow.
Yes, we are accepting walk-ins. Saturday.
Oh, really? And where is it going to be held at?
It is going to be held at... It's on the website if you go to myfreehearttest.com. But we are at the Holiday Inn right off of Port Washington Road.
I know exactly where it is. My Free Heart Test. Was it .com or .org?
.com.
Just do it in real time.
Might as well.
See, and then I can sign up for it right now.
Exactly. Maybe I'll see you tomorrow, Saturday.
Cool. So one of the questions I had is, what's the antecedent causing heart and kidney issues if it's really not just genetics? I mean, is it just some unknown thing that we just don't know? Or is it particular to the Black community? Or is it larger?
I think, from everything that I've read, it is multifaceted. Like, there's many pieces. And I think looking at the bigger picture is really important. And again, going back to like the future medicine, cardiometabolic health, it's not just looking at just your heart or just the kidneys. It's looking at all of it together. And there definitely are certain lifestyle factors that can affect that
can exacerbate it and make it worse.
Exactly.
But there's really nothing that can make it go away.
Again, it depends, right? Each person is unique.
Okay.
So, fun. Did you know that the standard American diet, the acronym for that is the SAD diet?
Yes.
Yeah. And a lot, it cracks me up because it's kind of true. It is kind of sad that, the food that most people have access to, especially in the States, are incredibly processed and incredibly high in different nutrients that we know are not good for us, like very high in the LDL cholesterols, which are the
basically junk food.
Exactly. And so if that's all you have access to, there's that old saying, you are what you eat. That is definitely one component.
I see college students going and they're drinking, like Mountain Dew in the morning. And I'm like, you do know by the time you're 40, your kidneys are going to say, we're only going to be like 80% today because
they're going to tap out.
It's like, just because your body can do it now doesn't mean it's not causing damage.
Exactly.
You could run 26 miles or you could run 14 miles.
Right.
But understand that when you're young and you can run 26 miles, it's going to damage you so that later you can't run. So you might want to run 14. But we don't really think about food in that way. We don't think about blood or kidneys.
No, it's like the foundational pillars of health, right?
Yeah.
Of sleep is another big one. Hydration,
Oh,
your
okay,
nutrition.
now she's hollering at me. See, I
all
don't know why
those
you're hollering.
things.
Can I complain to your husband and say you're hollering? She's hollering at me to get more sleep. That's the one thing I don't. I sleep 5, maybe 6 hours a day.
Are you consistent with it?
Yeah.
Do you feel well rested when you wake up?
At my age, no.
That's fair.
Actually, I feel bad. I feel worse when I sleep longer.
Yeah, well,
If I sleep 8 hours, I'm going to wake up dragging.
I mean, there is some research out there that shows it is often better to get consistent sleep than trying to binge sleep if you've been low on sleep.
Write that down. I'm going to play that back so whenever everybody can play. Like,
So now
Joanna
you don't have to yell at my husband.
Joanna said. So why does kidney disease seem to permeate just the Black community? Like, is there something about that?
Yeah, so kind of rewinding a bit too, I name dropped it earlier. There's the APOL1 genetic variant.
Okay.
That, it does kind of look specifically at sub-Saharan African descent. And so anyone who may, thousands of years ago been exposed to African sleeping sickness, similar to people who may have been exposed to malaria and they have a higher prevalence of sickle cell. There was thousands of years ago that benefit, and for whatever reason, when I was looking it up, it looks like they're still trying to fully uncover the mechanism of why is this genetic variant causing kidney problems. They seem to know, okay, so you have this genetic variant, therefore you're encountering some kidney issues. I don't exactly have a specific answer as to
Right.
Yeah.
And so there's still work that needs to be done, and that's why it's important that the community comes in and at least gets tested and they have their blood so they can use it as part of the research.
Well, exactly. And I think, something I know you talk a lot about is education, right? And at least the way that I think about it, if there's been a disease that has been in a family for generations, there's not necessarily going to be the education there within the family because that's just how it's always been to know that, I shouldn't be feeling this way.
Kind of become normalized.
Yeah, it's kind of become normalized. And so, that's really one of the core things that Care Access is trying to also bring to the table. When someone comes in for the screening, we aren't just going to take your blood, shake your hand, and say, have a nice day. Part of the process is sitting down with that individual and talking through, okay, here's the disease state of Lp(a) and how it could be affecting the system as a whole in a negative way, and making sure that when someone walks out from the screening that they are better informed for their health as like a whole picture kind of thing, so that they can go to their communities because it's genetically driven. It's important for if you do have elevated Lp(a) that not only you but your family also get screened because it does tend to run in families. So having that conversation and having equal representation. Yeah.
So I'm going to let you go, but I still have one more question.
Yeah,
right?
Totally.
What does Care Access look like in 10 or 20 years? Like what we know you're doing the research, and we know this is one of those things that's going to benefit the Black community because you're dealing with them directly. But where does this end up in 10, 20 years?
Yeah, you could say, where's the future of medicine heading in 10, 20 years? I mean, no one can say for sure, but at Care Access, our hope is definitely that the future of medicine is more inclusive towards the communities that have been historically underrepresented in clinical research. And the more that screenings like these help bridge that gap between Black communities and medical treatment and research, the more likely that future is realized.
All right. Well, thank you much.
Joanna
Dorbin from Care Access. This is great. I want to have you back on in the coming months. I'm going to be having shows as we lead up to, Breast Cancer Month and Prostate Cancer Month in November and those types of things because it's a part of health. But I think this is important because in the end, if we can cover the complete person, then we can remove the barriers of race and really make access to good health care based on good, solid research, something we can all be proud of. So thank you for coming.
Thank you for having me. Yeah, hopefully if we get enough of a showing at this event this weekend, we'll be able to come back in the future months for more screening events.
Sounds great. Holiday Inn, Milwaukee Riverfront. You can go to myfreehearttest.com. Thank you much. I appreciate it.
Thanks for having me.
All right.